I used to think I was alone in dealing with my feelings when it came to my addicted children, but as it turns out, I'm not. The National Drug Association estimates that 1 in 4 18 to 20-year-olds have used illicit drugs just in the last month alone. Further, the Substance Abuse and Mental Health Association estimate that 20 million Americans suffer from substance use disorders, that 25 million of those use illicit drugs, and that 16.5 suffer from severe alcoholism. All those people, all those kids, they have parents like you and I, and they have loved ones. So we're not alone. We're not on this journey by ourselves. So today I want to talk to you about 5 secrets that I found help me in my road in dealing with my addicted children. But before we do, you know how this works. Please subscribe below. Please hit that subscribe button. Click on that little bell there. It'll tell you when I submit new videos so you can get an update. Doing that will help me, help us have this conversation, so I know if I'm on the right track or not. I know how many people are interested in this conversation. I'm interested in it. I hope you're interested in it as well. But the only way I get that feedback is hitting that subscribe button. I was told once that it's like starving to death and being placed in a room where there's food all around you and told don't touch any of it. You're going to do anything you can to get to that food. You're going to do anything and say anything. So our kids often say things that are very bad. They don't mean them. They just want the drugs. So the first thing we have to do is begin to start to strengthen our relationship with our kids. And that has to do with changing our attitudes and our languages, because we're not going to be able to change them, right? We can't control them. It's one of our 3 C's. We can't control our children. So we can control ourselves though. We can control the way we look at them, the way we understand that this is a disease, and the languages that we use. So in strengthening the relationship, we need to stop judging our children, stop yelling at our children, stop telling them that they're bad and that they're evil because they're doing this and that they can quit anytime. And we need to lead by example. The second secret I've found is encouraging positive behavior and treatment. When there's too much focus on their behaviors, their bad behaviors, their illicit drug-taking behaviors, their lying and the deceit, which they do, it not only degrades their relationship, but it also diminishes their self-esteem. It puts them into a negative cycle as well. And again, it doesn't do anything to strengthen our relationship, right? So we have to begin to encourage the positive behaviors with them in the treatment. And we do that by changing the way we actually have conversations. For example, using language like, you can be successful and I believe in you, or you're smart, how can I help? These are positive words of encouragement that focus on outcomes of our children rather than demeaning them with hateful words that only cause them to revolt back in what they're doing. So that second secret is encourage positive behavior in treatment in how you're dealing with them. The third secret that I have found in helping me deal with the feelings associated with my kids' addictive behaviors are establishing clear guidelines. It's so important to set the ground rules of what is acceptable and not acceptable when it comes to recovery. I've talked to a number of kids that have had years of sobriety under their lives and asked them one simple question: what was the thing that most influences you when it comes to your sobriety? And they all say it's when their parents set up guidelines, when they established clear rules of what recovery was going to look like in their family. What was acceptable was not acceptable. So that third criteria becomes important for them to begin to work their life out in your family. Remember, this is about your quality of life. We can't control them. We didn't cause this, and we certainly can't cure this disease. But what we can do is lay out boundaries of what's acceptable and not, and it's establishing those boundaries that now enables them to begin that road to recovery. The fourth secret I've found that's helped me in dealing with my addicted children is you need to set boundaries. It's a lot like the guidelines in step 3, but this is a little different. Guidelines were more for your children. The boundaries are more for me. And that is, you need to start establishing what you will and won't do, right? Will you pay off drug dealers? Are you going to get up in the middle of the night, go down to the corner of 5th and 8th and pay off a drug dealer that your child is indebted to because of their addiction? What will you pay for treatment? Are you one of those parents that will pay nothing? Or are you going to pay $30,000 a month or $100,000 a month? Are you going to give up your 401k plan for your children in order to get the treatment? What are your boundaries? What are the things that you're going to say, this is a line I will not cross, but this is a line I will? I'm willing to give my child, for example, healthcare treatment, but at the same time, I'm not going to tap into my savings. Are you willing to wake up in the middle of the night, like I did, 1:05 in the morning, go down to Kensington Street here in Philadelphia and look for your child shooting heroin on the streets because you know that they're down there? Boundaries are for you, and you need to sit down and really think hard about what you're willing to do and not do when it comes to helping your children recover from this addiction problem. The fifth secret we have is you really need to practice self-care. Now, I'm going to do a separate video on this because it's so important, but self-care is the key to success when it comes to this. If you are not mentally happy and healthy, there's no way that you can help your wife, your significant others, your family, your friends. There's no way you can do your job, right? So you need to practice good self-care when it comes to keeping you happy and healthy. Mental health, physical health, social health, right? The three hells that we got to deal with. And I know it's hard. I know you don't feel like you want to even get out of bed sometimes. I was crying underneath my desk when I found out that my son was addicted to heroin. I didn't want to come out. I didn't want to do anything. But what we've found, what I've personally found, is the thing that gives me the best strength is when my brain's working, when my body's working, and when I'm socially connected. So that fifth issue is you need to work on those aspects that get you physically healthy, mentally healthy, and socially connected. So that's it for today. We've talked about my 5 secrets for dealing with my children's addiction problems. These are my secrets. Did you find them useful? Please comment below, right? Please comment below. Did I miss anything? We covered 5 important areas. Is there a 6th one? Which one do you think is most important? Comment below. I will respond. I am here. I monitor that channel. You write a question, I'll respond right away. In addition, please subscribe. You know where it is. It's the little subscription button down there. Click that bell again and move forward. It's the only way that I know I'm on track and doing the things that I need to do so that you and I have this conversation. Lastly, don't forget to join the other communities, right? I'm on Twitter. I'm at Alpha Dog Father, right over here, Alpha Dog Father. In Twitter, I'm constantly tweeting on a number of different issues that are out there, but all of them related to us fathers, us parents of children who have addiction issues. So if you're interested in continuing this conversation, please engage me on Twitter, engage me in YouTube, and we'll continue this conversation in a later event.